Hey everyone, so today we are going to talk renal drugs or drugs for your kidneys. So let's get started. Well, your kidneys, first and foremost, you have two of them, and they're responsible for filtering waste and excess fluids from the blood, which are removed in the urine. Now, your kidneys degrade over time, unfortunately. So once you are after the age of about 25, your kidneys start to go into decline. So I'm 26. I am well past my prime, unfortunately, in terms of kidney health, as are many of you. I hate to be the bearer of bad news, but that's how it is. Now, kidney disease or chronic kidney disease is otherwise known as CKD. And that's what happens when your kidneys just aren't filtering adequately like they used to. So CKD involves the gradual loss of kidney function. So there's few or non-specific symptoms earlier in the disease. You can't really tell if your kidneys aren't functioning to their 100% best, especially early on in the first early stages of kidney disease. However, it's usually detected in a lab test before you even know it. Now, advanced CKD can actually cause dangerous levels of fluid and electrolytes and wastes to build up in the body because it's not being filtered from the kidneys down the ureter, through the bladder, and out through the urethra when a person urinates. So that is when advanced CKD may need to be treated with medications. Now, treatment for CKD focuses on slowing the progression of kidney damage. So we want to do whatever we can to prevent all of those things, those waste products, those electrolytes, those other ions from interacting with the kidney and having to pass through it. We want to make the kidney's job easier with these drugs. So that can be done either through drugs or through dietary and lifestyle changes, vitamin supplementation, as well as medications. Now, if we get to end-stage renal disease, which is kidney failure or the last stage of chronic kidney disease, that is fatal without artificial filtering or dialysis or kidney transplant. So that's when you have to be hooked up to the dialysis machine like this. You usually go 2 or 3 times a week, and that machine filters your blood and does the work of a kidney for you. It is sometimes painful. It's certainly a very tiring process, but it's what some people need to do in order to survive with end-stage renal disease. Now, researchers recommend lifestyle changes to prevent chronic kidney disease. Some of these might include consuming more vegetables. That actually has a reduced odds for CKD, reduces those odds of developing chronic kidney disease by about 21%, which is excellent. Moderating alcohol consumption also reduces your risk of CKD by 15%, and higher sodium intake increase the odds of CKD by 21%. So we want low sodium foods, more vegetables, less alcohol, or at least moderate alcohol consumption. And this is what you can see the difference between a normal kidney versus a diseased kidney. Now, right off the bat, they look different, right? But you can see the glomerulus and the collecting tubules. These are what filters from the little capillaries in your kidney. The glomerulus and these little tubules and kidney cells are what filters the waste products from your blood out into the ureters and out of the kidney, eventually leading to the bladder. Now, as you can see, when there's scar tissue, when there's a damaged glomerulus, damaged tubules, damaged kidney, a damaged nephron, that is indicative of a diseased kidney that's not filtering the blood properly. And as I mentioned before, there are different stages to chronic kidney disease. After 25, you are automatically in stage 1. You are born in stage 1 of chronic kidney disease. You always have stage 1. It ranges from stage 1 all the way down to stage 5, which is kidney failure. That's when we're looking at dialysis or advanced treatment methods. There are 2 renal medications for CKD that you need to know about. The first one is cinacalcet or Sensipar, and that is a calcimimetic that increases calcium sensitivity. So it mimics calcium in the body. Now, why do we want it to do that? Well, it lowers blood calcium, phosphorus, and parathyroid hormone, or PTH, in patients that are on dialysis due to severe CKD. It's taking the burden off of the kidney, having to process all of those different hormones and minerals and vitamins that are in the body. Now, we have to monitor, of course, for hypocalcemia because of that, or low calcium, because, of course, when cinacalcet is displacing calcium, then we can run into some issues with low calcium levels. The other one we have is sevelamer carbonate, or Renvela. That's this one down here. And it is a phosphate binder which is taken to help phosphorus pass through the GI tract, the gastrointestinal tract, rather than filter through the kidneys. So if we can replace or redirect where that phosphorus and other phosphoric compounds are being filtered out of the body. So if we can get them in the GI tract and just have them not have to go through the kidney whatsoever, that is ideal, right? So it's used to lower high blood phosphorus or phosphate levels in patients who are on dialysis due to CKD. And it has the additional benefit of lowering high cholesterol because it works in the GI tract. Now, there are drug-drug interactions. You don't want to take it too close to when you're taking levothyroxine, fluoroquinolone antibiotics, or tetracycline antibiotics. And side effects, as you would imagine, include gastrointestinal side effects. So the main side effects for Renvela are constipation or diarrhea, nausea, and vomiting. That just about sums up our renal drugs. As always, if you have any questions, let me know.